Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. Nice to be back with you. We have this show, which is a fresh live show. As I say, you can pinch me, it's so live. We're in the WOR studios in the heart of Manhattan. We're taking your calls. We have a lot of interesting cases from the week. We have some new news from the week that's medical. The point of this all is to give you information to have a healthier, longer, better life, to get better treatment, and have an outlet to communicate and discuss logic, because that's what really medicine is logic. So my name's Dr. Gil Lederman. I'm from Radiosurgery New York. We're a cancer treatment center. And I want to start out with a case that's really interesting. This woman just came in 2 days ago and saw me. She's a 55-year-old woman, married with 2 children, and in January 2013 she had terrible pain starting in her face. She was worked up, she had a scan, and she was found to have a meningioma, which is a benign kind of tumor by the trigeminal nerve. Trigeminal nerve is a nerve that carries sensation from the face back to the brain. So the sensation means if someone touches you on your face, you can feel it, and sometimes the trigeminal nerve goes awry and causes pain. In this case, she had a tumor pressing on the trigeminal nerve, causing that, and she was seen by her doctor, a local doctor, and he sent her to a big neurosurgeon at a big hospital, and he decided to give gamma knife treatment. Now, she had gamma knife treatment back in 2013. Gamma knife treatment is focused beam radiation. It's the first equipment that was developed by a neurosurgeon named Lars Leksell in Sweden. And there's screws that go into the head. There's screws that go through the scalp, into the skull, into the bone. And all the treatment's given in one day. So she had that treatment at this big hospital. And since that time, it's curious because her insurance company paid the doctor and the hospital $30,000. The doctor keeps on sending her bills for $70,000, and he won't even return her calls. So she is beside herself, as you can imagine. She's got this kind of brain tumor, meningioma. She had gamma knife treatment. They've paid $30,000 or kind of extract $70,000 from her. She still has symptoms, and she doesn't know what to do. Her husband heard about us on the radio show, this show, and she came in on Friday. So what are we doing? Well, first of all, I met with the patient, which was interesting. I got her history, which was interesting, as I said, meningioma on the trigeminal nerve. What's curious is the she says, and I believe her, the doctor barely spent any time with her. There were only 2 visits. Each time he came in with a clock to measure how many minutes he spent with her. She got her treatment and now won't speak to her, won't return her calls, can't get any information. So, number 1, a couple lessons here, and I've talked about it before. On average, if you go to the hospital, studies have shown the cost is about 200% higher. Well, here it's about 1,000% higher than our costs. We would never do this to a patient. We don't even charge those amounts. And we were the first ones in New York to do brain radiosurgery. So before this big hospital knew what was brain radiosurgery, we were out there treating patients. Experienced since 1986, experienced performing brain radiosurgery. In 1993, we stopped doing the form of radiosurgery in the brain where there's screws in the head, and yes, she said it was very, very painful for her. And there's data showing that if you divide up the treatment into a few fractions, you avoid a lot of the adverse harm on the surrounding tissues like the brain. So, wow. Was there 10 reasons for her to come to us rather than this guy at this hospital who charged 1,000% more, who won't return her calls, who saw her twice and came in with a clock to measure how many minutes he was with her, rather than satisfying her and satisfying our questions and satisfying the questions of the family? Maybe he just satisfied his clock. So if you need your clock fixed, I would advise you to go there. If you need your brain tumor treated or evaluated, you might want to go to the expert who's been at it since 1986, was first in New York with brain radiosurgery, who does not put screws in your skull, who does not cause that kind of pain, performing a safer method of treatment, brain radiosurgery for benign tumors like this, acoustic neuromas, meningiomas, pituitary tumors, and also for cancers like metastasis and glioblastomas and astrocytomas. So think about where you'd want to go. The expert who brought this technology to New York, the expert with thousands of cases over decades, the one who charges about 1/10 as much, and who returns your calls. Wow, what a difference. What a difference. And I'm not just tooting my horn. Those are the facts. And the next case points that out. Here's a gentleman. He's a scientist, 60 years old. He came to me Friday. He's a scientist on Long Island. I treated him for an acoustic neuroma, left-sided acoustic neuroma, in 2002, so 12 years ago. He had fractionated stereotactic radiosurgery for acoustic neuroma. Our system is totally painless, totally non-invasive. We hit the tumor. We don't hurt healthy tissues. He's been stable throughout these years. He's had follow-up scans which have shown the success. Over those years, he's called me many times. I don't charge him or not charge him for a phone call or for follow-up evaluation when he needs his films reviewed. He came back Friday. We sat down. I examined him. We went over it. We arranged a new scan. But he's been intact. His hearing's intact. He's had no adverse side effects from the treatment. And that's what fractionated radiosurgery for brain, and in fact for body cancers, is all about. Hitting the tumor without hurting the healthy tissues. And here's a man, 12 years later, stands in great distinction to the first patient, whose surgeon won't even return her calls, who monitors by the clock, not by satisfying the patient. So, wow, what a difference a day makes. And here's another case from the other end of the body. Beautiful Russian woman with anal cancer, metastatic to the liver. She was treated about a year ago by us to the liver, and the liver was controlled. She lives in the Midwest, came in for review. She went to see another doctor first at another hospital, and they were going to give her more radiation to the liver by infusion, when in fact her cancer was in the lung and lymph node. She had a new PET scan in Michigan. She sent it to them first. They were going to re-irradiate the liver, even though that wasn't the only site of cancer. In fact, there was only a small nodule which they couldn't hit with just an embolization. Embolization is when treatment is given through the vein or artery. Well, you can't hit a little nodule. That goes throughout a large area of the liver and can harm a large area of the liver. The beauty of radiosurgery is we can focus in on what we want. If we see a small dot in the liver or the lung or the bone or the adrenal or the kidney or the spleen, wherever, we can hit that. Embolization sends treatment to a vast area. It's not focused like radiosurgery. Radiosurgery is non-invasive. Embolization is invasive. So there's a huge difference in treatments. Just like radiofrequency ablation is an invasive procedure with a lower success rate than radiosurgery in general. So this woman has a nodule in the lung, one, which she wants treated. She has a nodule and a lymph node in the chest she wants treated, and in the abdomen. So it's very different focused treatment, and our success rate for anal cancer is around 90% for the rest of the life of the patient where we aim the beam. So thank God she came in. We're getting her treatment going. She just came in on Thursday. She'll have her first treatment now, and we'll follow her so she'll know and we'll know and everyone will know, her family and loved ones, about the success of therapy. So we're going to stop. We're going to hear a word from our sponsor. But first, I just want to tell you that if you do have questions, you can call us at the WOR studio, which is 1-800-321-0710, 1-800-321-0710. We're taking your questions. We're live. We're happy to speak to you. And if you call us during the week, we'll send you the free booklet DVD. And we have 3 particular books, one on brain tumors, one on body cancers, and one on prostate cancers with actual data. So here is Ed giving you a word from some new voices from radiosurgery.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. We're live. We're taking your calls, so please feel free to call us. You can call us on the WOR